Good morning, good afternoon, or good night to any or all of you tuning into this video. This is a presentation for English 3236 section 066H, a class given by Professor Sandra Rios called Technical Communication in the University of Puerto Rico, Mayaguez. This presentation is going to be titled Diagnostic Methods and Treatment for Breast Cancer in Puerto Rico. As a part of the objectives for this presentation, I will be talking about the different forms of propagation and growth for breast cancer. I will also be presenting different detection and treatment methods, and I will be also discussing breast cancer's predominance here in Puerto Rico. Before we begin talking about what exactly is cancer, what then is breast cancer, and the different methods and ways we can diagnose and treat cancer, specifically breast cancer, it is important that we know a little bit about the anatomy of breasts. On the picture to your right, we have a side view of the breast, and as we can see, it presents the muscle, the adipose tissue or fatty tissue as many of us might know it. We can see the ducts and the lobules. The lobules are glands that are in charge of milk production. The ducts are in charge of transporting the milk produced in the lobules to the nipple. And then we have the fatty tissue or adipose tissue, which is the fatty tissue covering the lobules, ducts, lymph nodes, and blood vessels. Now that we know a little bit about the anatomy and the parts that compose a breast, we can begin talking about breast cancer itself. Breast cancer is the abnormal growth of cells. These cells will then invade and destroy all of the normal tissue. Now, breast cancer can begin in any part of the breast, and here we distinct two types of invasive breast cancer. We have IDC or invasive ductal carcinoma and ILC or invasive lobular carcinoma. IDC or invasive ductal carcinoma is the type of breast cancer which is more common and predominant. 8 out of 10 women who suffer breast cancer will suffer from IDC. This type of cancer begins in the cells that surround the ducts and will then have the ability to metastasize to other parts of the body. When we say metastasize, we mean that the cancer can spread from the place where it began, i.e. the ducts, to other parts of the body. Now, ILC or invasive lobular carcinoma begins in the glands that produce the milk. As well as IDC, it has the capacity to metastasize to other parts of the body. But lobular invasive carcinoma is the most difficult invasive carcinoma to detect via a physical exam or an image exam. In comparison to other types of invasive carcinoma, 1 out of 5 women who have ILC or invasive lobular carcinoma will have cancer in both breasts. There are other special types of breast cancer which are subtypes of invasive carcinoma. These are a lot less common than the ones described beforehand and constitute less than 5% of all breast cancers. These are the adenoid cystic carcinoma, the adenosquamous carcinoma, medullary carcinoma, mucinous carcinoma, papillary carcinoma, and tubular carcinoma. As we can see, they receive their names given the characteristics they show when each and every one of them are observed under a microscope, and as well as the different ways the cells are grouped. The most important thing to understand here is that breast cancer in itself isn't the only type of cancer. breast cancer does have a family of diseases, like the ones we saw in the slide before and the ones that are presented in this slide. Most of the women that do have breast cancer will not present either signs nor symptoms during diagnostic tests. But it is possible that women with the disease present changes in the appearance of their breasts. Most of the times, women that present these symptoms do not necessarily have breast cancer, but it is important that we know what kind of symptoms these are. Some of these symptoms for breast cancer are lumps, skin changes, pulled in nipples, or what doctors call inverted nipples. We can have redness or rash, dimpling, and dripping. When we talk about dimpling, we can talk about pudy orange, which is a disease in which the skin presents the appearance as if it were an orange peel. And when we talk about skin changes, we can talk about Paget's disease, which is when the nipple presents an eczema or some type of dripping out of it. Now that we talked about the different symptoms for breast cancer, it is important that we now talk about all of the forms of detection. And it is important that we first of all talk about the self-evaluation or self-examination of our breasts. Doctors recommend that for every woman, a monthly self-checkup must be realized. For breast cancer, the most important thing is that early detection saves lives. As a part of the forms of detection, we will be talking about mammograms, ultrasounds, MRIs, the Gale model, and family history. We will go into detail for every one of these 5 forms of detection. We will first talk about mammograms. Now, mammograms are an X-ray study of the breast by means of low-dose X-rays to detect changes in breast tissue. For women over 40 years old, mammograms are done to reduce mortality rates by up to 25 and 30%. There are 2 types of mammograms, and we will first begin talking about the detection mammograms. These detection mammograms are recommended annually for any woman who is 40 years old and on. And these type of mammograms are done when no signs nor symptoms are presented for breast cancer. The other type of mammogram are the diagnostic mammograms, which is then for a woman who already present any clinical anomaly. The image presented on screen is what a mammogram might look like. We have 2 plates that will push and squeeze the breast until it has a clear image. Now, an important part for mammograms are that we cannot use deodorant that day because deodorant might present itself as calcifications on the images, and we do not want that as a false positive for our tests. Another type of detection form is MRIs. These are used in women who have already been diagnosed with breast cancer. MRIs measure the cancer size, and it can identify other possible tumors in the area being studied. One of the advantages for MRIs over mammograms are that MRIs can take a picture of both breasts at the same time. Now, MRIs can observe and detect tumors in the other breasts. For women who have high risk of breast cancer, MRIs are recommended as a form of detection, and a mammogram is recommended annually. As I stated before, the advantage of an MRI is that it can detect both invasive cancers and benign cancers at the same time when looked at the image of both breasts. Invasive cancers and benign cancers can look similar. Because of this, the patient will be then referred to a deeper tissue study through biopsies. Another form of detection are ultrasounds. These produce photographs by means of sound waves of the internal structure of the breast. Ultrasounds are used to diagnose lumps or masses that the doctor might find during any physical examination. The images by ultrasounds are captured in real time and the structure of the breast is shown in real time, showing the patient the movement of all the inner breast components. Now, ultrasounds are recommended for women with small breasts because in mammograms you need to pull and stretch the breast so that you can get a clear picture. For women who have small breasts, ultrasounds are the better option. Other than being used mostly for women who have small breasts, ultrasounds are also used as a follow-up exam after an abnormal clinical finding of the breast. Another form of detection is the Gale model. The Gale model, also known as the Breast Cancer Risk Assessment Tool, is a model that can calculate the risk of having breast cancer within a 5-year period or during your lifetime. This Gale model takes into consideration many risk factors, one of them being the age of your first period, the age you had your first child, your first degree family history. When we talk about first degree family history, we mean cousins, sisters, aunts, or your grandmothers. Number 5, the number of breast biopsies realized. 6, the number of biopsies that showed a typical hyperplasia or any abnormality. And last but not least, race. The last form of detection I will be talking about is that of family history. I'll give you a few seconds to try and figure out who it is you're seeing on screen. If you still don't know who I'm talking about, the woman presented on screen is Angelina Jolie. If you're trying to understand how does Angelina Jolie mix in with breast cancer, well, I'm going to explain why. Her doctors estimated in 2007 that she had an 87% risk of breast cancer and a 50% risk of ovarian cancer. Now, although the risk is different in every case for each woman, only a fraction of breast cancers result from an inherited gene mutation. The genes I'm talking about are the BRCA1 and BRCA2 genes, or the BRCA1 and BRCA2 genes. Women who have a defect in the BRCA1 genes have a 65% risk of getting breast cancer. We call Angelina Jolie a breast cancer advocate because when she saw that there are other forms of detection rather than the ones that I've talked about, being mammograms, ultrasounds, or any of the other methods of detection, she wanted to let anybody and everybody know that there are other options. As she states, she wants to encourage every woman, especially if you have a family history of breast or ovarian cancer, to seek out the information and medical experts who can help you through this aspect of your life and to make your own informed choices. Breast cancer alone kills 458,000 people each year, according to the World Health Organization, mainly in low and middle income countries. It has got to be a priority to ensure that more women can access gene testing and life-sentence preventive treatment, whatever their means and backgrounds, wherever they live. Angelina Jolie is called an advocate because she knew that not everybody can afford $3,000 to test for BRCA1 and or BRCA2 tests. The cost of these tests are at average $3,000 in the United States, and this remains an obstacle for many, many women. As for breast cancer's predominance in Puerto Rico, the percentage of breast cancer is a total of 29.8% of all the cancers detected in women and 18.1% of all the cancer deaths in women. Statistically, 84 out of 100,000 women annually will develop breast cancer. Now, as a conclusion to this presentation, we have talked about the different forms of detection, being self-evaluation one of the key and most important. We have talked about the different methods of treatment. We have talked about predominance of cancer in Puerto Rico. Now we can conclude that radiotherapy is still the most effective and most used treatment in order to avoid deaths due to cancer's propagation. Breast cancer is still a relevant issue not only in Puerto Rico but worldwide because of its high mortality rate. And last but not least, it is important that we still promote breast cancer awareness so that it can still be studied for better treatments, diagnostic methods, and a possible cure.